One of the biggest things that I do in my practice is non-surgical therapy, meaning Botox and fillers. What's really amazing today is that these treatments that don't require surgery are so powerful for almost any age. The majority of my patients are 40 plus in age, but I've got many patients who are in their 30s. I've got a few patients in their 20s, and I got a few patients in their teenage years. You say, well, Dr. Lam, you must be insane for dealing with patients so young. Well, first of all, there are 20-some-year-olds that have some early aging it's easy to fix. You don't need surgery. It can be a small expense. And some teenagers, the ones I've treated, are usually professional models. They want slight changes to their face to tweak where they are, but majority of my patients are older. The category, when you get into your 50s and 60s, a lot of these patients would benefit from surgical therapies. But if you watch my video that I just shot on a virtual consultation for facial rejuvenation being both surgical and non-surgical, you understand how I use one or the other. But for non-surgical therapies, facial fillers in particular, it really, almost any age group works extremely well for them. Botox is also very, very important. I have a whole 12-minute video on my philosophy of Botox, and I've got separate videos on different categories of Botox. What I'm really going to talk about today is the use of cosmetic injectable fillers or dermal fillers. So I want to walk you through what I see. So before I begin to talk about the actual technique, I want to take a step back and give you my philosophy. The philosophy begins with what Malcolm Gladwell calls blink. And the blink idea is that in a blink of an eye, we make a judgment about another human being. When I shake your hand, when you shake my hand, when you look at your best girlfriend or best guy friend or whoever it may be from 20 feet away, you know their age. You know how they look, what you feel about them. Are they tired? When they get closer, you can tell their emotional state. You can tell if they're well dressed. You can tell if they smell good, if they're articulate. You can tell if they're overweight. And all of these feelings occur in a nanosecond. You know that feeling about the person. Are they feminine? Are they masculine? Are they tall, short? And so what I'm trying to treat is a feeling. And that sounds very vague, but really being an artist, you really start to understand that that feeling is so important, because the feeling about a face is what I think is important. It's not, can I make a lip bigger? It's not, can I blow up a cheek? It's not, can I fill a fold? It's not, can I fill a lower eye bag, which obviously may be the reason you came to see me, but it goes much deeper than that. And when I work on a face, all these ideas are in my head as I'm designing. And that's so important that you understand that. Let's talk a little bit about, what products I use. I've gone through a lot of different treatment options in terms of products over the last 15 years in practice. And now the mainstay for me for facial rejuvenation is hyaluronic acid-based products such as Restylane, Lyft, Voluma, Volbella, etc. My mainstay for the majority is a Restylane-based treatment, and I just find that the product works extremely well around the eyes, and we'll talk a little bit about why the eyes are so important. But, I've gone through a period of time where I was using a lot of bellafill and permanent fillers, and I had some complications with some firmness. The product sometimes has an aggregation quality that's firm, and patients didn't like that. I don't think the product's a bad product per se, but in my hands, having done thousands of syringes, I had enough of these small problems. I decided, you know what? It's better to move forward and go with hyaluronic acid-based products. The biggest thing people always ask is, what's the longevity? Because if you Google Restylane, Lyft, you'll see, it's only going to last you 6 months, 6 to 12 months. And I honestly believe that these products are almost semi-permanent. Now, what semi-permanent means, a few qualifications. Number one is I will never get anything perfect. I'll just improve it. So I may fill your temple 4 times, and you say, Dr. Lam, you filled it again, because to really fill a temple perfectly is not possible. To fill a lower eyelid perfectly is not possible. I can just continue to improve your face. So that's one caveat. The second caveat is that you're going to absorb it a little bit. There's no way that what I fill with a little bit of swelling that I'm reading is going to be staying perfectly where it is. It's always going to come down a little bit. And the third element is that there's going to be further aging. And so that is the truth of this, is that with further aging, you will have further loss. But I'll tell you a story. I had these 2 flight attendants from Houston that came into me does come in to see me every 6 or 12 months. And they said, Dr. Lam, is it a waste of money for me to do 1 or 2 syringes a couple times a year? Because to do math on that 2 syringes is less than half a teaspoon. So it's a very small amount of product. And I showed them a photo when they were 51, and now they're 60 years old. And I showed them that 60 years old, they looked younger than they did at 51. Now, keep in mind, here's 51. If that photograph were taken today at 60, it wouldn't look like the same photo. It would look 9 years older, right? I'm comparing it to an image where they're 9 years younger. And they already look 9 years younger than 9 years ago, and this photo would have looked over here. If you do the math, that's like 30-year different. Obviously, it's not 30 years, but you get my point, is the fact that it cumulatively builds. And my staff have been doing these products. They've been with me over 10 years, and I've been watching this them with this product, and I've doing this product since 2004, when it was FDA cleared in the United States. So I'm seeing incredible longevity. I'm seeing that it stacks on itself, it builds really well, and over the long haul, it's done well. And if you don't like it, I can dissolve it. So a lot of pros that I see with hyaluronic acid-based products. The longevity is there, the safety profile is there, the softness is there. The biggest thing with this over the long haul is that cumulatively you build and build and you get better outcomes. So that's a philosophical principle. The other thing that's really important is to walk you through how I design, because it's not just filling a fold. In fact, the folds, it's funny, where most people fill are cheeks, folds, and lips. Cheeks, folds, and lips, over and over and over again, the same thing. And believe it or not, those are the three areas I rarely fill. Now, why is that? So let's actually talk about that before I talk about what I do, what I don't do. I always jokingly say, and I'm also quite serious about it, what you pay me for is not only what I do for you, but what I won't do for you. So the lips. The problem with the lips is not the overdone, crazy lips that everyone sees. Even if you take a well-designed lip, which I always give well-designed lips, and I can do a whole nother video, which I should probably do on lips, but the reason why lips don't work is a few reasons. Number one, it's not a priority zone. Even people say, you know, my lips look terrible, I want to look younger. But it's not how people relate to each other, it's the eyes. When we have a social professional encounter, the eyes are what we engage in. When you're looking at my video right now, you may have looked at my mouth a couple times, but really 99% of the time you're concentrating on my eyes. And you're making an emotional connection with me at my eyes. I do the same with you if you're sitting in front of me. You do that with your friends. So the eyes have priority. So when you focus on the lips, one, you waste money. Two, and this is a big one, is that the lips won't match the face. And so I've got old videos I shot maybe 10 years ago that I need to probably re-update and all that, but they still have validity, is that the lips, when you get older, change a little bit. And so when the face has not been rejuvenated and you focus on the lips just don't match the face is insane. So again, I encourage you to watch some of my old lip videos from 10 years ago. They still have relevance today. But I will go through probably in a separate video more in detail about my lip philosophy. But I just want you to understand why that is a problem area when they don't match. The other thing is the folds. The folds, I do treat one area called the canine, but in general the fold is overrated. And when you're doing the folds, the problem with this is that the more times you treat this fold, just the stupider you look, because it's just a waste of effort. I put that as a very low priority zone. So what's the best way to design? The best way to allow me to design your face is to give me a carte blanche, which means just basically give me freedom to design. And that may sound scary when you initially don't have a relationship with me, but over time you'll have that comfort zone. Oh, before I get to that, I apologize. One area I left out was the cheek. I told you I was going to go through the top 3 things that people do that I don't do, and I do the other things that people don't do, which is really funny. But the cheek area, and you do the anterior cheek, and even now my new philosophy is going down to the central buccal zone. You got to be careful. This area right here, when you smile, it starts to look overly bunchy. So where I'm really working is on the perimeter of the face. So I work on what I call halos. And so let's address that concept for a moment. So the halo concept that I really developed and try to make it in a way that I can communicate not only to my colleagues, but to my patients as well, is that the eye starts to circumferentially lose volume. And when the eye starts to lose volume, you need to restore that volume. And that makes a big difference. Then there's a perimeter of the face is the second halo, and the third ones are on the mouth. Let's take each of those 3 components a little bit more in depth. So the eye area is an area that we think, oh, we're having saggy skin, we're having an eye bag, I gotta take the eye bag out, I gotta cut away the skin. But the brow is actually like a balloon, and so when the balloon starts to deflate, you fill it up a little bit, bam, you look better. You look better instantaneously. It's really counterintuitive, right? Because you come in, you say, I've got too much skin up here, Dr. Lamb, take it out. But I say, no, let's put a little volume in. You're like, what the heck is wrong with this guy? We put him in volume. It works. And what I've found is when you look at bone transition points, from bone to soft tissue transition points, if you put a little bit in where the bone is most obvious, which is here and here, the lateral endpoints, you don't even need a lot of volume. I can be very conservative with my syringes. In fact, I tell my patients if I can do 1 syringe, it'll be better than someone's 4 syringes. I really know how to leverage the quality of the injection. So putting a little bit inside here and putting a little bit to the tail of the brow where the transition of bone is there, bam, you look better. The other thing, and this is I published in 2 articles last year in 2015, in January 2015, is that when we get older, you see these eyes start to slant like they're hanging. And so what I do is if I just fill a little bit in this A-frame deformity, that's the sort of the scientific name for that little notch that we have in here, the eye looks less slanted. It goes from a sagging perspective to a horizontal perspective, and all of a sudden it looks young. And if you say, Dr. Lamb, I don't believe what you're telling me is true. This must be some kind of weird idea that you came up with. I challenge you. Go back and look at photos in Vogue and Glamour of young women. Go look at your own photo when you're in your early 20s. Now, I know most women don't like their face as full as it in their early 20s, but if you don't start going back and understanding the fullness of your brow, you're going to think, I need to get all my skin taken out, I got to have my brows way lifted up. And to me, that makes someone not look natural. It doesn't make them look youthful. It makes them look cadaveric and empty. If anything, I'm trying to do is reframe that eye. And it's very interesting because a lot of people tell me, you know what? My eyes are getting small. And believe it or not, the eye looks bigger or more open when it has a frame. When the frame is evacuated and you have this eye sitting in the middle of this empty socket, it looks smaller. And when I frame it, the eye looks bigger. I know this makes no intuitive sense, but it really works. The lower eyelid is also, I like a colleague of mine that's talked about the rocks on a shore. So think of rocks on a shoreline. When you see rocks on a shoreline, you may think, okay, I hate those rocks, I'm going to remove those rocks. Well, what are the rocks? The rocks are the eye bags. The shoreline is the fact that on low tide, you see these rocks. Sometimes you just got to raise the shoreline back up to cover the rocks. That being said, if the bag is not so large, raising the shoreline is putting a little filler at the orbital rim, and just bringing that back up a little bit will create a balance where the eye bag all of a sudden miraculously disappears. Now, in large eye bags, it can't do that. But that framing of the eye is what brings that attention, that vitality back to the eyes, the beauty, the youth, the freshness, the connection, the emotional connectivity that you get with a filler. You said, well, can you get all that with just 5 minutes of filling? Absolutely you can. And that's so important to think of that. The next element of filling is the outer perimeter of the face. And so what is an ideal shape, especially for women, is more of an oval shape. So the oval shape means the depression of the temple, especially now considering, now I'm even filling into the hairline, and the subzygomatic arch. So what that is if this is the zygomatic arch here, okay, and there's usually a concavity above and below. And so when we think about facial design, we always look at faces from 3/4 side views. But I'm connecting with you on a frontal view, and that's the view that I want you to pay attention to, because that's when I fill. As a surgeon, I'm always sitting on the side looking at the patient doing surgery, like a facelift or rhinoplasty, but even on those surgeries, I go to the front. And so when I'm filling a patient, I fill from the side, I come back to the front, I look at you from the front, and I make a decision about how much more I need to fill. Because you could blow up this temple and it looks really good from a side view, you go to the front view and it looks insane. The front view is king. That's why I always come back and make an assessment of the emotional connectivity that I've created there by doing so. This area works well for heavy faces and thin faces. So, well, why would I widen this face if I'm overweight or heavy? And here's the reason. Because when this area is bigger, this area looks smaller. And this is the area when we get heavier. This, using my little Christmas wave too, I've got a little fullness here. This area, when this is heavy, this is sunken as we get older, it actually makes you look older. So I want to rebalance a face. And another trick that I do, and I've talked about this in another video, is I actually oftentimes with people that are overweight by maybe 10 or 20 pounds, I Botox this area, that slims the face, and it brings that ideal shape like this back, okay, which is the triangle with the top heavy triangle versus a bottom heavy triangle. So that's one of the great things that fillers can do, is reshape a face to look better. So the biggest concern people have is, will I look different? No, you will still look like the same person. People can't put their finger on it. They just think, wow, you look better. And it's like picking an orange blouse versus a purple one if you look better in a certain color. I'm here to design your face in a way that your best friend or your spouse won't know, but you just look prettier, you look handsome, you look better. And that's about facial balance. The understanding of facial balance, I use an analogy. Think of a glass of water on a television screen. If I said, how big is this glass of water? You would say, I have no idea. I put a shot glass next to it, this one all of a sudden became really large. I put a pitcher of water next to it, all of a sudden this glass of water looks small. So relative proportion is so critical. When a lot of patients come in, they say, I've got a wrinkle, I've got a fold, that's what I want treated, Dr. Lamb, this wrinkle kills me, but you can't see it from a social distance. I can barely see it at 3 inches, but women see that because they put makeup on very close, and so all these little wrinkles are bothersome to them. But now, if the wrinkle is deep, I need to laser it, I need to fill it. I've got, that's a whole, I can talk about the subject forever, as you can see. But my point of this is I don't want you to waste your money. So I'm always trying to help guide you on spending your money wisely to get the best leverage per unit dollar you spend with me. But let's finish with these halo concepts. So the outer face ovalization is so important. Now, to finish this is the halo around the mouth. As I alluded to earlier, I don't just fill the fold. To me, it's a waste of money. But there is a component of the fold that does make a difference. A colleague of mine out of Los Angeles has looked at this area called the canine, and he looked at women morphing using all these technologies and looking at aging from women in their 28 to 34 and morphed over a three-dimensional image of amalgam of 100-some women, Caucasian women in their late 60s, early 70s, and looked at what is that change? What are we, if we're assuming aging is A, but let's look morphologically, let's look at the changes of faces that occur over 30 years. What is the aging? This canine is so critical. So I put a little bit here. It allows me to save, instead of putting a whole 1 or 2 syringes here, which I just think is a waste of money unless you have the whole face perfect, then I will put a little bit there, and it just changes the angulation and makes things look so much better. The other part is the pre-jowl. So when this is starting to hang, before you're ready for a facelift, just a little volume here will look great. So this is that. So these 4 points help that halo around the mouth, and also to me the anterior chin. So sometimes what I'm looking for is little shadow points, to manage those little shadow points to improve those areas. And to me that is really, really critical there. Another quick topic is aging nose. About 20% of my facelifts I do some kind of rhinoplasty on. I encourage it because the nose looks older. And so what I do is if someone's, look, I'm not ready for a rhinoplasty, I don't want a nose job, or they don't need one, a little filler here or there, it can actually shorten the nose by the same principle that I'm talking about. If you've got a bulbous tip and you got a slight depression here, if I filled up this depression, it can make everything look more in harmony. And so that's why these little tricks, and the nose takes so little product. I can do a rhinoplasty for like $50. I mean, it's so not very expensive at all for me to do my work in the nose area. And that's why it's so worth it in my opinion. The other thing I want to talk a little bit about is how I design, and then I'm talking about what techniques I use in terms of the instruments. But when I'm looking at a face, what's so important is looking at shadow points, is looking at transitions from bone to soft tissue. So it's not about augmentation. It is to some extent, but it's looking at those bony transition points of shadows. So when I tell a patient when they come in, hey, I've got 20 areas to treat, the reason I'm saying that is not because you look horrible, but because I'm looking at all those little problem areas. And as I'm building those little problem areas and finessing it as a completely different experience from elsewhere, I will make you look better and better and better. And that's the art of what I do, is a little drops and a lot of little areas to make things look better. That's so, so, so critical for the design work. And I liken it to this. If you are let's say you have a 1965-year-old home, and 1965 home, and you're trying to build this 2016 kitchen, or 2017, well, we're at the tail end of 16, so for those that are watching it next year, 2017-year-old home, it's not going to work. Just like I talked about the lips being young and the face being old, it doesn't work. And if you have no aesthetic eye, you won't know what you're doing. You're just making people look insane. So, and I always tell my patients is that your standard of natural is here. You think you see all these unnatural results, but I'm catching all the ones that are unnatural. So if you're worried about looking unnatural, don't worry, because I'm taking it to another level of naturalness, because you're missing a lot of the ones that look fake. Now the obvious ones are obviously there, but you're missing a lot of them. But the point of this is that going back to this analogy, is if I'm building a home, I want everything to work. And so I don't want to run out of money if I redone the kitchen that doesn't match the bathroom now. I put some money in the kitchen, I look at it, I come and put a little bit in the bathroom, I come and put a little bit, so everything works. You know, if you talk to an interior designer, they're not just making this spectacular sofa and everything around it looks off. You have to have a good sense of taste. If you are not an artist and you cannot look at beauty, you shouldn't be injecting faces, you shouldn't be designing faces, because you don't know what is good. And I spend years with my staff training their eye, because they're my second pair of eyes. So what's really cool about this is not only do you have my eyes, you have my staff eyes. So we're here, and the angle of light is different. As I'm injecting this side of the face, this side of the face looks slightly different, and I don't want to run out of product. And my staff have been liberated to be comfortable talking to me. Say, Dr. Lamb, hey, how about this point over here? I'll come over there. I either agree or disagree with them. Now, disagree doesn't mean they're wrong. Agree doesn't mean necessarily they're right. It just means, hey, thank you for the insight. They're not just standing there holding an ice pack or a vibration device, which we'll talk about in a moment. They're thinking actively, and they're participating in the design work. And just as artists have assistants, I have assistants. And this is truly artistry. So I tell my patients three things, or several things. Number one, I'm not going to waste your money. I know where to put the product to make the maximal design. So when you become more comfortable with me, I encourage you to give me full carte blanche in the design. And that's the first thing. The second thing is, I'm not going to make you look unnatural. I'm not going to give you a big cheek or make things look insane. I really want to design in a way that's going to work for you, okay? And number three is, I'm not going to make you look like a different human being. I'm going to make you look a lot better. And so sometimes my work is very subtle. You look at my before and afters, you get a feeling that they look so much better, but you have no idea what the heck I did. And so like in my lobby now, I've got these before and after images, and people say, like, they look better. I don't know what the heck you did, Dr. Lamb. Was it a nose job? Was it a chin implant? Was it a facelift? And what I now have to do is I label it so people then can focus on the points of change. But that's what is beautiful, is not the patients that you walk down the hall and you go, oh my God, what happened to that guy? It's natural. It's keeping your identity, and it's not wasting your money. And the best way to do that is you build trust with me, is to give me a carte blanche on the design. That's really, really important. Now, to me, this is as important as everything else, as your experience with me and my technique delivery. I am one of the few doctors out there that uses almost exclusively cannulas. Now, the reason I say almost is that little intradermal areas, you got to use a needle. What is a cannula? A cannula basically is a needle without a sharp end. Why is that so critical? I hate to say this, vision loss, necrosis of the tip, necrosis, really problem things when needles are used around the eyes, noses, or even parts of the mouth area here. I use cannulas in these sensitive zones that have risk. How many people use cannulas? Very few. And how many people can do it well? Even fewer. Cannulas are critical. They are the linchpin, the cornerstone to what I do in terms of delivery. So these are great. And I've worked so hard, even with the manufacturer, to manufacture a better cannula. Ones that deliver a safer result and more painless result. And that's why I'm so passionate about cannulas. I've been using them since October 2010. Well, what are the advantages cannulas provide for you? Number one, safety. I've already alluded to that. I've already gone through that with you. That's so important. Safety trumps everything else. Number two, less discomfort. Because I'm able to place the cannula under the skin through a little needle stick, and underneath the skin, I fill all what I want to fill. That placing under the skin allows me the capacity to stay where I want and continue to augment. Number three is a lot, more accuracy. Besides less pain, more accuracy, I can place it and fill beautifully. And number four is potentially less bruising. And the reason I say that is that without a sharp end, especially around the eyes, and my entry point is farther away, a lot less risk of bruising. And I've even got techniques with blue light therapy that I just learned in Nashville, which is great. That's a great thing about teaching and running a major meeting, is I also am there learning as a student. I ran this injection course and said, I learned something. Blue light can manage early bruising. And then also I've got KTP for late onset bruising. So I've got a lot of techniques for bruising if need be. The other thing that's very important is pain control. So a lot of people are needle phobes, or even if they're not needle phobes, I say, look, isn't it better to fly first class? I fly economy all the time, so I'm not trying to use an analogy that you have to fly first. When you come here, I want you to have a first class experience. So first class experience means I have great staff, I've got educated staff, I've got nice staff. Hopefully I'm decently nice to you. And then with the technique, it's hopefully relatively painless. So I always tell patients that here's my Botox pain, here is my filler pain, here is someone else's Botox pain, and here is someone else's filler pain. It's way high. I use a lot of vibrational energy. Why vibrational energy? Because what happens is our brain can only register one sensation at a time. It can either register vibration or it can register pain. If I can overpower you with vibration, your brain just cannot feel the pain. So people ask you to use numbing cream. Numbing cream is useless. It's not useless, but truly what I do is everything is below the skin anyways. So I don't go there stick you 100 times. But placing it under the skin with this technique allows me true ability to really, really design in a beautiful, beautiful way that manages pain. And then I use a vibration device. My assistant uses a vibration device. And using vibrational devices truly help in delivering the best outcomes so that patients don't have the discomfort level. So for me, this is a very long video. It doesn't even cover everything I want to tell you, but I wanted to address in this video a large part of the design philosophy that I have, and you're going to hear this again when you come in for consultation, the experience, the safety, and all those elements that are very, very important and core to any treatment that I deliver for you.